Hello, I'm Dr. Preety Aggarwal. I'm a gynecologist at Motherhood Hospital, Sector 57, and today we are going to talk about fibroids. Now, what are fibroids? Fibroids are one of the most commonest tumors that we see in the female reproductive tract. But tumors does not mean that it's something that we need to get scared of. They're actually benign, they're non-cancerous in most of the occasions. And there are kind of cells which are basically fibrous tissue and muscle cells which form these tumors. They're one of the most frequently seen tumors in the female reproductive tract. In fact, if we look at statistics, the American College statistics that we have, those say that nearly about 75 to 80% of the women which reach the age of 50 years may have fibroids. And if we look at one Indian statistics which is there, this says that if we actually see all women in a busy gynae OPD, then about 25-30% can present with fibroids. Now, what are the risk factors for developing such tumors? So sometimes we see there is a family history, like we'll see mothers and sisters will also present with such tumors. Also, we see that people of the darker race more commonly have fibroids. Obesity is one of the criteria also, because obesity is also associated with some hormonal changes. Diet and lifestyle choices can sometimes also be other reasons, besides early menarche and late menopause. So all these, if you see these risk factors, you see that some of them are related to hormonal changes. So estrogen dominance seems to have a role in the fibroids. And as they're a tumor of the reproductive age group, and they're seen more in the reproductive years of life. So what are the symptoms that patients present to us with in a case of fibroids? So some of the commonest symptoms is, heavy bleeding. Heavy and prolonged menstrual cycles is the commonest symptom that patients come with. Also, in some cases, painful periods is another symptom that the patient may present with. There may be some patients who have very large fibroids may come to you for the first time that they're having a very enlarged lower abdomen. They're suddenly seeing some swelling in the lower abdomen. Some patients may have pressure symptoms if the fibroids are very large. So they can have urinary symptoms. They feel like going to pass urine again and again. Or they have constipation. That means there's a difficulty in passing stools. Also, some fibroids, if they're associated with pregnancy, they can cause pregnancy complications, and sometimes we can have a presentation of postmenopausal bleeding also. Some patients who are trying for a pregnancy may also present for the first time with a fibroid, a large fibroid, which may be causing problems. So, how do we actually make a diagnosis that fibroids are there? So the first thing is obviously a good history taking by a gynecologist or healthcare provider, and an examination, that is a physical examination, which is both which is both an abdominal exam and a pelvic exam, which is done. And after that, your doctor may tell you to get a good ultrasound done, where we are trying to see what is the number of fibroids, what is the location of fibroids, and what kind of fibroids are there. So fibroids can be there on the surface of the uterus, they can be in the muscle wall, or they can grow inside the uterus also. And we see normally that the ones which grow inside the uterus are the ones which cause maximum amount of problems. Now, once we've done all these investigations, ultrasound is done, but sometimes, we also require to do an MRI for some cases where there are multiple fibroids, they're very large and they may be causing pressure symptoms on other organs also. And now coming to what should we do to treat the fibroids. So fibroids are actually treated according to a lot of reasons, First of all, what kind of symptoms are they causing? So suppose a fibroid is very small, it is not causing any symptoms, and it's been just discovered accidentally at a routine examination that you had. Then they are just monitored and they're not actually, nothing is done about them, but the gynecologist keeps a check on you, keeps calling you for regular exams and keeps a track of the fibroids. But if the fibroids are causing you symptoms, they're affecting the quality of your life, that is when the treatment is required. So if you're having very heavy bleeding, your hemoglobin is dropping, or you're having very painful periods, or you're having these pressure symptoms, or a fibroid is suddenly growing very large in size, that's when we really need to manage it. So the management can be first in terms of conservative management. That means if their symptoms are very mild, then we can use only medications to kind of see that your bleeding is not heavy, to see that you don't get any deficiencies, your hemoglobin, everything is fine. That could be the first set of management. Second is that do we really need any surgery? So yes, there is surgery today which is available. We can specifically remove fibroids also, and we can also, remove it laparoscopically. So such surgeries do not cause much of a problem to the patient, and recovery is very fast. So according to the location, laparoscopic myomectomies may be done. Sometimes for very large fibroids, you may need an open surgery also. And a person who is close to menopause or something and has very large fibroids, very heavy bleeding, but is 40, 45 plus, in that case, sometimes a uterus removal or a hysterectomy may also need to be done. There are other modalities which are also available today for fibroids, like uterine artery embolization or vaporization of the fibroids by using MRI or laser. So these are other options which are available, but I think the best is always to get to a good gynecologist and try and assess what kind of a fibroid you have, discuss all your problems, and then see what is the best treatment. But this fibroid treatment is never an emergency unless you're, really becoming anemic or bleeding very heavily. So you can take time and you can make the best decision possible. Thank you.